Let's talk about Weber transformation surgery in Weber type 7B with patella, with a kneecap. This is a special technique, the transformation, where useless parts of the body transformed in useful parts. Type 7B is the most severe form of the tibial hemimelia, and there are patients with a kneecap and patients without. I want to talk about the treatment of the patients who have a kneecap, because it's much better to have a kneecap, because I have designed a special technique where we can use this kneecap. And this has a severe effect. You can see on my score system that normally this type is the worst score, number 5, and with the patella it rises up to the score 4, so it's much better. This technique I present here is awarded twice from the German and the European Society for Pediatric Orthopedics. This is an example of a child with this form. Of course, it's a girl, 26 months. She is not able to walk because there is no knee joint, there is no ankle joint, and only the fibula, the kneecap, and the foot is there, but have no connection to each other. The first part of the treatment is to bring this limb into external fixator. External fixator has the job to distract the soft tissue in order that I can do the transformation surgery. Here another case, this distraction partially can be done also by cast. It's the first child I have treated ever over nearly now 30 years ago. He is multiple handicapped with bilateral club hands and bilateral tibial hemimelia. And we are talking about the treatment of this small bone here. This is the fibula, and for comparison you can see my index finger is much bigger than the fibula of this child. And here the contracture of the joint has to be treated first with cast. And then comes this treatment with the external fixator, which you have seen already in the video. This is to distract the soft tissue and to enable the transformation surgery. And this is the transformation. How to use the kneecap as a joint partner. And this is the trick, and this is why I was awarded. First, the quadriceps tendon has to be lengthened. Then this blue circle is the capsule, and this capsule is incised 3 times, which the result that I have a proximal visor flap and a distal visor. And at this moment I can bring the kneecap, which is here, down. And at the moment I bring it down, I have already a joint partner which is part of the knee joint. So when these flaps switch towards each other, I can bring the patella to the fibula, connect these both. The patella is working as joint partner for the knee, and the fibula is working as tibial bone. This is called transformation. Here's a schematic drawing for this. The ligamentum capitis fibulae. This is a ligament which is attached to the head of the fibula, can be used also. I will show how. Then the soft tissue lengthening, and then we have done the transformation. Periost flaps for stabilization of the foot. The patella is now part of a knee joint which was not there before, and the ligamentum capitis fibulae is working as a cruciatum ligament, which gives additional stability to the knee joint. Here you see X-ray series. This is 1 year after the surgery, correct axis in both views, and here you can see again my index finger, and there is a tremendous hyperplasia of the fibula. And this is what we achieve and what we get from children. Give the fibula the function of the tibia and you receive the adequate form. This is called form follows function. This is the MRI from the lateral view. This is the femur, this is the fibula. The quadriceps tendon is inserted naturally into the kneecap, which is now the tibial plateau and forms the knee joint. And this is 7 years after the procedure. You hardly can say that this was a fibula before. It has the size of a tibia and also growth plates on both ends of the fibula, which ensure additional growth. This is the function. This child has full extension and can flex till 85 degrees and can walk on it. The fixator on the left side is for treatment of the other leg, which has to be treated differently. This is the good function, good flexion and good extension 5 years after the surgery. 7.5 years after the operation, you can see the boy walking. He has braces to stabilize the growing leg from outside and to prevent any damage to the result we have achieved by the surgery. And this is only needed outside. He can walk inside the house without it, but important is that he doesn't damage this knee construction. And he can run very well, as you can see. And he can not only run, he is very sportive. He is doing skiing, he is playing soccer and do all the other things. This was the situation when he was 18 months old. With 2.5 years, he was able to play soccer. And with 16 years, he became hobby-wise a firefighter. So the post-operative results after 25 years, he has full weight bearing, he's doing sports, he has no pain, no fractures, his job is an office job, his hobbies are traveling the world, doing some sports, and we have a good range of motion of both knees, and the ankle range of motion on the left side is excellent, on the right side was a stable arthrodesis. If you're interested in more details, I wrote chapters in these 2 books. Thank you for your attention.